In this final vaccine section, we will be reviewing the side effects of the vaccines and their effectiveness in protecting against infections with the SARS CoV-2 variants. What about side effects? As this figure shows, mild to moderate systemic side effects are common following vaccination and include fatigue and headaches and muscle aches. These symptoms, as well as chills and fever, are more common after the second injection, but usually resolve within 48 to 72 hours. They are indicative of a strong immune response. Serious side effects are rare with the mRNA vaccines. During their trial, a few recipients developed swollen lymph nodes under their arms, axillary adenopathy. Following the phase 3 trials, the most common serious reaction has been anaphylactic or immediate hypersensitivity reactions. Symptoms can include tightness of the throat, shortness of breath, lightheadedness, and low blood pressure. The incidence is very low, 4.7 per million for Pfizer vaccine and 2.5 per million for Moderna. In the majority of cases, this reaction occurs within 15 to 30 minutes of receiving the vaccine, and nearly all cases have been described in females with a history of frequent allergic reactions to other vaccines as well as medications. For this unique group, vaccination should only be administered in a healthcare facility with appropriate emergency personnel. Recently, a rare severe autoimmune reaction has been identified in women ages 18 to 49 years. The reaction occurs 6 to 14 days following vaccination, at which time women experience headache and or abdominal pain accompanied by a low platelet count and clotting of a large vein draining the liver, portal vein thrombosis, or the large veins draining the brain, cortical venous thrombosis. This complication has only been described in those receiving the adenovirus vector vaccines, AstraZeneca and Johnson & Johnson. Thrombosis is caused by the production of an antibody against a platelet protein called platelet factor 4, PF4, that activates platelets and induces blood clotting. This complication is rare, 1 to 2 per million vaccination, but is often fatal. If alternative vaccines are available for women in this age group, the adenovirus vector vaccines should be avoided. Keep in mind that COVID-19 is frequently associated with thrombosis as well as death. Therefore, the benefit of the adenovirus vaccines far outweighs the risk of this rare complication. Another major concern is whether the SARS CoV-2 variant strains will escape vaccine protection. As described earlier in the pathogenesis and epidemiology videos, SARS CoV-2, like all RNA viruses, is very inaccurate at proofreading, resulting in many mistakes or the generation of mutations. 5 variants of interest have proved to be of particular concern for SARS CoV-2. Do these mutants affect vaccine efficacy? This table summarizes the findings with regards to variants and vaccine efficacy. For the alpha variant, efficacy is identical to the original viral strain. The beta and gamma mutants that both contain the EK variation, 484E to K, while the delta variant contains a 478T to K mutation. These two variations change the spike protein conformation and cause a modest reduction in the efficacy of disease prevention for all vaccines. Vaccines showing the biggest drop in efficacy are the J&J vaccine, 26% drop, followed by Sputnik V, 12% decrease, and Novavax and Sinopharm, 10% decrease. The Omicron mutant has 50 mutations, 36 of which are in the spike protein, including 10 at the amino terminus, the region that is recognized by antibodies and T cells. The marked change in amino acids has been associated with a greater reduction in vaccine efficacy. As shown in this graph, Pfizer efficacy drops from 94% to 33% efficacy for preventing disease. If a booster or third shot is given 4 to 6 months after the original 2 shots, efficacy increases to 75%. When it comes to protecting against hospitalization, the 2 doses of Pfizer vaccine reduce hospitalizations by 70%, and following booster, protection from hospitalization increases to nearly 100%. J&J and AstraZeneca protection against Omicron drops to 0%. However, a booster restores efficacy to 75% for both vaccines. These breakthrough infections raise questions about how long the 2-dose vaccines are protective. Studies now reveal that immunity significantly wanes after 4 to 6 months, and with the emergence of the Omicron variant, a 3rd shot or booster should be given to everyone within 4 to 6 months. Based on recent experience, experts now conclude that full vaccination means 3 doses of the vaccines. The 3rd dose should be given 4 to 6 months after the 2nd dose. With regards to J&J, a 2nd dose is now recommended 2 months after the 1st dose. The duration of the 3-dose vaccination will be protective is presently under investigation. A second question also arises. Should we be administering boosters specifically directed against the variants to ensure high-level protection? To date, boosters directed against the original virus appear to achieve protection, obviating the need for customized boosters. Some of you are wondering, Dr. Southwick is calling for a 3rd shot when many in the world have not received a 1st shot, and inequity in vaccine distribution is a major concern. Until the entire world has been vaccinated, new variants with increased ability to spread from person to person and evade the immune response will continue to arise. The developed nations must step up and help the developing nations, or we will never control the pandemic. The haves must help the have-nots. To summarize the content of this video, RNA lipid nanoparticle vaccines have an excellent safety profile, the major side effect being immediate hypersensitivity reactions that only occurs in 2 to 4 per million administrations. Adenovirus vaccines have one serious side effect, rarely inducing the production of an antibody that stimulates clotting in the veins of the abdomen and central nervous system. Vaccine efficacy is reduced only modestly by the beta, gamma, and delta variants. The Omicron contains multiple mutations in the antigen recognition sites, markedly reducing the efficacy of all vaccines, and this drop in efficacy can be reversed by a booster or 3rd shot. With the arrival of the Omicron variant, full vaccination now requires 3 vaccine doses. We are only as strong as our weakest link, and when it comes to controlling the pandemic with vaccinations, the haves must help the have-nots. We need vaccine equity.